Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Digoxin. Brand name is Toloxin. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. In this video, we'll discuss the mechanism of action, or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Digoxin. Then discuss examples of dosing, and then finish it off with side effects. I've put together some slides to go over this information, so let's jump right into it. So the first thing to discuss here will be the mechanism of action, or how this medication works. So Digoxin inhibits sodium-potassium ATPase. This causes an increase in the intracellular sodium concentration, leading to an increased intracellular calcium concentration. Autonomic effects lead to positive inotropic action, reduced sympathetic response, and decreased renin-angiotensin system output. In terms of indications or reasons we would prescribe this medication, we may use this medication for ventricular rate control in chronic atrial fibrillation, as well as in the treatment of heart failure. With respect to contraindications or reasons we would not be able to prescribe Digoxin, we wouldn't use this medication in a patient who had a hypersensitivity to Digoxin or any other component of the formulation. As well, this medication wouldn't be used in patients who have ventricular fibrillation. Now, for some examples of dosing, just keep in mind that with this medication, the dosing would range from person to person and based on what condition they're using it to treat. So these are just some examples of dosing that you may see. In atrial fibrillation, using the IV form or intravenous form, we may see 0.25 milligrams intravenously, with repeat dosing to a maximum of 1.5 milligrams over 24 hours. If they were using the oral formulation in atrial fibrillation, we may see 0.125 milligrams to 0.25 milligrams orally once daily. In the treatment of heart failure, if a patient was using a tablet, we may see, and they're using it for initial daily maintenance, we may see 3.4 to 5.1 micrograms per kilogram orally once daily. In this situation, they would typically titrate or increase the dose every 2 weeks. If they were using an oral solution, again in heart failure, for a maintenance dose, we may see 3 micrograms per kilogram daily, and they would adjust as necessary. As with all medications, there are some side effects or adverse reactions that patients may experience while using Digoxin. We'll go over some of those here now. Some patients may experience dizziness, others may experience a headache with this medication. Nausea and vomiting are possibilities, as well as the development of a mental disorder. More serious side effects would be cardiac dysrhythmia, ischemia, sinoatrial block, or sinus bradycardia, which would be a slow heart rate. Alright everybody, that's all we're going to talk about today with Digoxin or Toloxin. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. But for today, take care.